babies. Okay, he's an expert. He's here on behalf of the Permanent Secretary of Ministry of Health, and we're going to be delving into the mass vaccination campaign starting from 2nd to the 8th. Let's talk about that.
Yeah, so this particular vaccination campaign, and you see those dates 2nd to 8th, the dates that have been selected specifically to roll out this vaccine in select regions. So we have this yellow fever vaccine that, and most people who've traveled would know that you cannot cross the border without being asked for a yellow fever card or a book. And that is an international requirement. Anywhere in the world, it's now been ratified by the World Health Organization. You cannot move from any country to any country without yellow book. And that's important because yellow fever is a kind of disease that is caused by a virus. The virus is called yellow fever, and it is transmitted by mosquitoes. Now, yellow fever falls in the same family of diseases with Ebola, with Marburg, with Rift Valley fever, with the chikungunya virus, and the rest. So you need to understand that yellow fever is such a dangerous disease. The same way you see Ebola is the same way you should see yellow fever. Because people who suffer from yellow fever bleed. Eventually they bleed just like the people who suffer from Ebola, only that they first turn yellow, the whole body, because the virus affects the liver. That's why they call it yellow fever, from that yellow color. And so the World Health Organization and all countries have ratified this, 192 countries of them, that we must have a card to show that a person has been vaccinated if they are to move from one country
because
to another.
Initially this has been for the travelers.
Thank you.
If you want to travel, that is one of the requirements, and others have been reluctant about it. So the question would be, why now? Yeah,
so now what we have noted is that increasingly we've been having increased outbreaks of these diseases, not just Ebola, but yellow fever. And remember, the mosquito that transmits yellow fever transmits also other diseases that are related to that. Like I talked about Marburg and the rest. Now, this particular disease, if only one person is found to have it, that constitutes an outbreak.
Okay.
Just one person who you confirm that they have yellow fever, that constitutes an outbreak. So it's a disease of enormous public health concern, because if one person gets it, the spread is very fast, and the chances of dying are very high.
So we're being
yet
precocious.
Yet we have a vaccine that is very effective, extremely effective vaccine. Long time ago, you needed to get it and then get it after 10 years and after 10 years. Now you no longer need, you just need one shot.
How's that experience for people who have gone through the vaccination?
So now this vaccine is quite safe. We can give it to children as from 9 months up to 60 years of age. So people who are above 60 years don't need to get this vaccine.
Okay.
Yeah, because they above 60 years, it become their body at that point react a little more severely to the vaccine.
Okay.
So all people above 60 are exempted. But there are very few people in the world who are above 60. If we could actually vaccinate the vast majority of people between 9 months and 60 years, then the people who are above 60 won't have anyone to give them the disease. Because the vast majority of those who would have brought the disease to them are immune by virtue of vaccination.
Okay.
And anyone who has received the yellow fever vaccine will tell you the chances of reactions like we see from other vaccines are very few. Okay. You don't get those high fevers, sickness, being bedridden for a long time, no.
Okay, so the period of from 2nd to 8th is a starter process.
Thank you so much. So you've actually given it the right word.
Yes.
Yeah, so what the government wants to do is this. We want to make sure that all children in schools, all people who go to churches, in the mosques, in the markets, anyone who is willing to take up this vaccine will be given this vaccine for free.
For free.
Do you know it's been very hard getting the yellow fever vaccine?
True.
People pay 100,000, 150,000, 180,000 to get the vaccine and the book. Now you are going to get this vaccine for free. You will receive a card and you can be able to travel. And this is going to be for the rest of your life. So it's a chance to vaccinate as many people as we can in those regions.
Okay.
Then after that, the vaccine is going to be made available in the routine immunization program, the same way we do the other ones for children.
Okay.
Yeah.
So that means from within that period, from 2nd to 8th, people should be vigilant about that.
Yeah, it's a chance to have as many people as possible get the vaccine, so that we put momentum into this process.
Okay.
So if your child comes from school and tells you, I've been given this later, they are saying, I need to get your fever vaccine, please sign it. Don't protect yourself and not protect your child.
And not protect the child.
Yeah.
Okay, I feel like 5 regions wouldn't be enough. You said you had rolled this out previously.
Yeah.
How did people embrace this?
So we rolled out phase 1, and now we are into phase 2.
This is phase 2.
Yeah, and we'll have phase 3.
Okay.
And people ask, why are we not just doing the whole country at the same time? The reason is because the stocks of these vaccines are not very easy to get worldwide. So we first get, the stocks that we can get, because the company that manufactures, and many countries are rolling it out. So the first phase, we did it in August, September last year. We went to Kabarore region, so that's the Toro region, and then we also rolled it out in the Lango region. I remember the minister rolling it out in the Langi region, and then we also gave it out in the Chigezi region. Kabare, all those regions were covered. So now we are going into the second phase.
Okay.
And this second phase, we are covering those districts that
and
you
how
mentioned.
was the report there? How was the turn-up?
I was personally supervising Kabarore region, and the reception was quite good, I should say.
Okay.
Yeah, there were a few people who had a few questions, particularly some schools. But what we did is that they are supervisors. So the Ministry of Health is going to dispatch supervisors from the ministry who are trained, who are equipped, and who know about the vaccine. And their duty is to work with the district health teams and the district health management teams to be able to explain this out to anyone who wants to know, to explain this out to the schools, to the churches, and just answer all the questions that you will have on yellow fever vaccine.
Okay, do we have any restrictions and considerations in this?
So that's a good question. Now, there are categories of people who will not get the vaccine.
Okay.
One is people who are allergic to eggs. Now, I'm not talking about people who are not eating eggs because they are dieting. No. The ones who said, me, when I eat eggs, I get nausea, or no, those ones are not allergic. People who are allergic to egg protein are those who, if you eat an egg, they get rashes, they get itchiness, they get, cough or something like that. So the egg produces severe allergies in them. That particular category will not get the vaccine. And the reason is because in the yellow fever vaccine, there's a protein, the egg protein. And the amount of egg protein in them is sufficient enough to trigger an allergy in the person, an allergic response. So those will not get. The second category of people who we are not going to give the vaccine currently are mothers who are pregnant. Okay. We will also not give it to mothers who are breastfeeding up to 9 months and below.
So those will come in phase 3?
So those, so that's what will happen is this. So if you are pregnant, you want to be pregnant forever. Once you give birth, you'll be able to get it in the health centers. Because remember, beyond this campaign, the vaccine is going to now be available routinely. Okay. Yeah, in all government hospitals. We'll give it the way we give the vaccines for children.
Okay.
So the vaccine is going to be available.
Are you planning on any outreach programs?
Yes. So what we are doing is that
door to door, yeah.
Yeah. So this particular one is, we won't go door to door the way we do polio, but we are going to make it come to very close to where you are, because it is going to be at your church. If you go to church,
I'm
it's
a
going
pastor,
to be at the mosque.
I have a church. Me
Yes.
and my husband, we have a church.
So you can get that.
Okay.
And your members.
Okay.
So in fact, we will be relying a lot on the religious leaders to help us up the numbers. And then we are going to make it available in the markets. So if you don't go to church and you don't go to the mosque, in the market, the vaccine will be there. In the schools, it's going to be available. Where your kids go to school, the vaccine will be made available there. So you can actually go and get it. And if I walk to a school and they're vaccinating, they can actually give me the vaccine.
Okay.
They won't tell me you are not a student.
Part of the school.
Even if you're just passing and you saw them giving the vaccine.
So
you
it's
can
just like mobile money.
Yeah. And then we are going to have it at health centers as well. At all health centers and health facilities. All of them, Health Center 2s, Health Center 3, KCCA vaccinations, all those centers are going
and
to
all
have the
these
vaccine.
specialized clinics that can that are qualified.
Yeah. So the ones that are listed immunizing centers, they will all have the vaccine.
Okay.
So the vaccine is going to be available from second. Just as you come into these Easter festivities, you'll be able, and you'll have all those days, 2nd to 8th, to be able to get the vaccine.
Okay.
Yeah.
Should we worry of anything?
Yeah, so that's a good question. If there is anybody who does not know that they have allergy to eggs, let's say, and then they get the vaccine, so the doctors are going to be on hand to be able to give you an injection that brings down the reaction.
Okay.
When we were in Kabarore, we found the vaccine was generally safe, even in the schools where we administered it here, and in the communities. I was quite happy when I went there. I'm an Arsenal fan, so we were having an Arsenal fans festival when I went to Fort. I reached there and I found the guys had organized a celebration. Yeah, they do that a lot. a national fans festival. And then we used that opportunity to mobilize the people around, and we got very many people to get vaccinated. We donated blood. So initiatives like this can be quite good. All those who attended that and we had a whole caravan riding through the city, and people coming and getting vaccinated, donating blood, and then after that we went for Nyamachoma and celebrated, late into the night.
Very interesting.
So that was quite nice. So initiatives like those can help us, whether they are churches, whether they are groups, and tell everyone, tell your women groups, tell your WhatsApp groups, let this message go out that you don't need to pay for yellow fever vaccine anymore and the book anymore.
But then that means that those that are already vaccinated do not have to come for the vaccine.
Excellent question. Now remember, before 2016, 2017, yellow fever vaccine you used to get, and you get again after 10 years. So now anybody who got vaccinated in that period actually does not need to get the vaccine. I'm not talking about those who bought books. There are few people who go and buy a book and then travel out of the country and don't get the injection. And they've reminded themselves progressively that I got vaccinated. Yeah, now they've forgotten that they were not. A lie told 100 times it becomes truth. You need to go get the vaccine. Maybe that time you feared money. You feared I didn't have the money so I could get the book easily. Now you can actually go get the vaccine and then keep your book knowing that you are vaccinated. Now those who are vaccinated and thought that they needed to get again because it was expiring in 10 years, you can go get. Anybody who is immune already can get the vaccine. It won't harm you.
So it's the shelf time for the vaccine is 10 years.
So that is what it used to be. Now we have removed that requirement and we say it's for life.
It's for life.
Yeah, once you get it now, you will not need to get another booster.
But those that have their 10 years expired,
they can go get revaccinate. Yeah, they can go and revaccinate, and then they'll be protected for life.
Okay.
Yeah.
Okay. So basically, you working with Ministry of Health, and in the area of your description, it shows that you're a vaccines expert. What is your take on vaccines?
So I need to say this, and this is an important question because someone asked me that why are we giving so many vaccines and so many campaigns these days? I mean, why don't, and people, there are people who've actually told me, I've never met a person with yellow fever. Why are you giving me the vaccine? And the point I want to say is this: prevention is better than cure.
True.
Better to prevent. I mean, they say, it's not that you're a coward. So the point is that we can only prevent these diseases using vaccines because vaccines are given to healthy people. They're not given to sick people. Actually, if you have a fever, don't get the vaccine. Yeah, these vaccines that are coming next week. If you are sick, you're admitted in hospital. Yes.
Because some people have malaria and they've not checked.
So we are not even going to go to the sick in the hospital admitted and vaccinate them. No. Vaccines are not for sick people. So if you are sick, first get treated and then you'll get the vaccine. If you are having a fever, don't get the vaccine. Treat the fever. You'll have enough days between 2nd and 8th to be able to get the vaccine. And this vaccine is going to now be available freely. So only those particular categorizations will not get. And the doctors who give the vaccine will actually ask you, you have a fever, are you sick? Yeah. And now, or are you pregnant or something like that?
Okay.
So, but remember that we are not going to vaccinate people who are sick. Only people who are okay can be vaccinated.
Okay, now, probably now my question would be, you are now doing the campaign right now.
Yes,
we are a national broadcaster, and of course this is our mandate to be able to tell the audience, to tell the public, what's to come or what's happening. But are you doing more awareness, not just with UBC? Have you rolled out this campaign seriously?
Brilliant question. So yesterday I was in Kayunga trying to, up the message around this vaccine. What the Ministry of Health does is this: it tells the people, we are bringing you the vaccine. Then the ministry organizes people from the central, from the Ministry of Health. It trains supervisors, equips them with the information, and sends them to the districts. And the role of these supervisors is to do two important things. One is to make sure that the vaccines have arrived, and the injections and the needles and the consumables, the stocks that are required to run the campaign. But secondly, to educate, to mobilize. So we are going to have in every district of the targeted districts, there will be messages on radio talk shows, there will be messages on these communities loudspeakers that go around in markets. That message is going to be there. We are relying on church leaders. Please pass the message. Pass the message. I'm quite happy because today some children in the hospital told me their teacher told them they are going to be vaccinated. On Tuesday they are going to be injected. So they know. The teachers have already started passing the message, and KCC circulated
but
letters.
Even for us to pass this message, maybe in my own shoes, now I understand why we need to vaccinate. But there should be a niche in the messaging, criteria, how you're going to put it out there. People need to embrace this. We don't just like force them. You need to vaccinate. Tell the children. And there has to be a catchy,
message,
way of promoting this so that people embrace it.
And you make a good point, because today someone asked me a question that left me thinking. A lady who I told about this vaccine told me, why don't you bring the malaria vaccine first? I hear in Kenya there is malaria vaccine, and instead of bringing as malaria
because
vaccine...
right now it's malaria that is rampant.
Yeah, why instead of bringing as malaria, you're bringing as yellow fever.
So people are like, why yellow fever? Now,
and
what's
so
happening?
It showed me two things. One, it showed me that what we consider a burden, we are more likely to embrace protection about it. Not like what happened during COVID days. The fear for COVID was a lot, and we all were going for the vaccine. People were looking for it all over. And the thing is that, okay, the malaria vaccine, by the way, is going to come next year. I should say that that's very good news for Uganda, because they're just like the way Kenya has rolled out, we are going to have it next year. I know malaria is a big problem and people really want the vaccine. Yeah, but yellow fever is equally a deadly disease. The same mosquito that transmits malaria transmits yellow fever. Yeah, and you just never know when it will come about. So my point is this: these vaccines are safe. If there is one reason, if there is one motivation for us to embrace vaccines, it's the experience with COVID. Without the vaccines, we would not be here. We would all be in masks. But now that we are vaccinated, we can move around. And COVID killed people. We cannot ignore that. Very many people died. In Europe and US, very many died. That was a good example. A second example, measles. Do you know that measles actually used to kill so many children that any child who survived measles was called born again? In fact, among the Kikuyu culture in Kenya, you were never allowed to count your kids unless they first suffered measles. You always have 10 kids. If they've not suffered measles, they may all die when the outbreak comes. So the gains around those vaccines and polio have shown that vaccines are important.
Maybe the message should be around the vaccinations that we already have. The measles, so that this is an add in onto the other vaccinations that we have.
And this particular one is coming at 9 months and onwards. And we need it. You never know. Your child may get a scholarship to go and study outside the country. Yourself, you may want to go for a tour. You need to get them vaccinated. Why should you go and pay for this when you can get this vaccine for free? We've been struggling to pay for it. Vaccine no kinonya kubura you look around, you cannot get it. Card to ina no to border. Niba kubonya wonya, you don't have the money to pay. The government has now provided it all for free.
And it's no longer a pinch. Now, I think you should also, in the area of creating awareness, you should also engage with social media. Social media right now is the in thing. Do a little bit of campaign, have people do a TikTok. I vaccinated and now I'm safe and blah, blah, blah. Yeah, we can come up with a campaign.
That's
and that, because now it is mass.
Take it on board.
Yes, because it is now mass vaccination. You need everyone to get involved. You need people to pitch in and love it and embrace it.
Absolutely.
So, yeah.
That's very good information. I think we are going to take it up at the level of the ministry and communication and just
and you can call in. You can call me in when it comes to social media.
And you can help us to pass this message. I love that, because at the end of the day, the more the people who get this message and get it correctly, the better. Men have been fearing to take this vaccine because they say it is going to make them...
the guy who asked you, I've never seen any patient with yellow fever.
No, men are even fearing that it will make them perform poorly in their home duties, as a man in the home.
Is there any scientific reality on that?
No, there's no correlation. If you are not rising to the occasion where, what was you are playing 45 minutes and they tell you get out of the pitch, you need to go see a doctor.
Dr. Omave.
Yeah, because those who say, since I got this vaccine,
things have gone bizarre.
Rise to the occasion so well. No, those ones, we need to find your problem and help you. It's not the yellow fever vaccine.
But now you're saying it is safe. We shouldn't have any after effect.
Neither does it increase. Don't say that since I got the vaccine, I'm now performing so well. No.
Doctor.
Just go to the gym. The vaccine doesn't increase that as well.
Doctor, listen. So it is practically safe.
Yeah.
We don't have to worry about any side effects.
You may get a bit of pain at the site where they're injecting. Yeah. And maybe a slight swelling. That's all. Yeah, a bit of fever, not much. It's actually, if you compare it with the vaccines that we give children who get high fevers at 6 weeks, 10 weeks, 14 weeks, this one is very safe.
So doesn't it interrupt with other vaccinations that are, the vaccines that are?
No, it doesn't. And remember, we're giving it at 9 months. Majority of the vaccines, we give them at 6 weeks, 10 weeks, 14 weeks. This one is coming at 9 months onwards. Like now for an adult, if you get it now, the last vaccine you got maybe was COVID 4 years ago. So this one is, let's embrace it. Let's get the cards. Let's protect our country. The other day we had an Ebola outbreak and Kasanda, Mubende, and the neighboring districts were locked. We don't want that again. Now remember, if we find a case in Kampala of yellow fever, the president will lock the city. Yeah.
So now you have,
let's protect ourselves.
Now you have a niche. You have how you can you put out the message. We want to see adverts on our very own UBC.
I think we'll work on that. Yeah.
Yes, you tell them we don't want to get into the same trouble we had when COVID-19 came. So we are being proactive.
And COVID has shown us that vaccines can work. They can save the world. There are people, we lost friends, we lost relatives, we lost what. But those of us who got the vaccine, by God's grace, we survived. We want to protect everyone.
Sure.
Because
Sibuti. I like the way you say that. Okay,
yeah.
Sibuti. So we want to see the Ministry of Health, working hand in hand with different, government bodies, with different individuals, with different consultants, like they're doing with you, to make this thing really mass and to be, proactive and very active in this campaign. So
one of the things I've liked about it is how other organs of state and community have embraced this vaccine. For example, KCCA, and it has written letters. We have community leaders, we have cultural leaders, and they've really helped us. The kings, the communities, the elders, they've really supported us in sending this message. And I'm using this opportunity to call upon them. Cultural leaders, the kings and their cabinets and their prime ministers. Yes. I'm requesting them, please, let's send this message out. Yeah, and like in Kampala, we are quite lucky. As we go for the Kabakaran, we shall also be there with our vaccine.
Okay.
Giving it out, yeah. So as we come to run for this particular very, very iconic run, let's also come and get our vaccine.
You need to come to us. We organize a campaign, an advert, and we put it out there so that it runs. And that advert should include all that calling. We call the leaders, we call the cultural, spiritual leaders to come and join in hands.
Yeah, and these celebs, these musicians.
Yes.
As people come to you,
can even have them come in and sing. Yeah, they can sing.
Let's embrace the vaccine.
Yeah, true.
We need them to help us. We need this message to go as far as it can go.
Thank you so much, Dr. Ombave.
Yeah, thank you.
Ombeva.
Yes.
You told me you love it when the sick
patients,
patients,
the kids come to,
they pronounce it differently.
Clinic. Yeah, Sumbeva, Subande, Ovande, Ombiva, Ombava. It's Ombeva.
So it's Ombeva Malanda, senior consultant, pediatrician at Malaga Hospital, Makerere University, and he is a vaccines expert. He's here on behalf of Ministry of Health. Thank you so much for coming in on such a short notice, and thank you for that detailed information on yellow fever vaccination. And we hope the campaign runs out very well.
Next week, second,
yes, we will rush in to get vaccinated. For now, we know the importance, and the age that should be vaccinated is from 9 months. Initially, I thought it's 1 year to 60 years.
Yeah, so it's 1 year to 60 years, but if a child is 9 months, don't lock them out.
Okay, so 9 months to 60 years. Those specifications, I think, will be broadcasted on UBC TV, and we'll also have that probably on the website of the Ministry of Health, just to give you details of the rolling out of all this campaign. Well, we're going to run out. Thank you so much for being with us from the very moment we started the news at 8 o'clock. My name is Patricia Lukoma Mpango. Let's meet again at 10 o'clock.